not wasting any time between, Sognsvann and this esteemed panel, where we hope will be inspiring all of you to have interesting, collaborative, inspirational conversations at Sognsvann. And we have to admit, we want to improve, but we haven't improved on this one. We forgot to tell everyone that all these annual conferences, before that one, expert conferences, ends with a party. So many people are leaving, and we are so sorry. We should, and we have to remember people to inform that you're not supposed to leave at Friday, because the big party is after the conference. Because sometimes we do it earlier, and then the turn up the day after is not so good. So that's why we do it to the end. And we will go to Sognsvann, but we have a slide on that one later. So I started the conference with talking about the difficult times that we kind of step up. We have tried to step up this year to be proactive, to be very concerned and specific about how can we strengthen health information systems in countries? How can we go back to basic? How can we collaborate more? And how can we actually, I see the title is not here, but that's fine. How will we be able to collaborate in order to strengthen health information systems in countries? We proudly present how can we actually keep DHIS2 alive? How can we keep the data systems alive when the investors are shutting down or thinking about something else? So I've been carefully listening through the week and put together a panel that can address various aspects of that one, and also give some, hopefully, inspirational comments on what we can talk about, how we can collaborate better, how we can kind of be able to work harder, better, in a more innovative and more collaborative than we have done before. However, we have some good news, and I was allowed to present it, even though it's not totally out there. We just heard, yes, we just got announced, but not announced as in public. It's not like in the radio, even though I'm a bit of a radio myself, that we got a new contract with World Diabetes Foundation for 4 years' work, $1 million. Yay! And that's very, very promising, because NCD data has been lacking in countries. It's really need to be strengthening. And the World Diabetes Forum have worked with Sri Lanka for 3 years, and also Tanzania and Malawi, and they liked the job. So now it's for the rest of the world. So, okay. That's the good news. Then a bit more back to reality. So we're starting with Aichat Samia, Permanent Secretary, Minister of Health for Maldives. And Maldives is a bit new girl in town. Huh? Not that long history of the DHIS2 in Maldives. And my question to you is, you have done initial investment in establishing DHIS2 in Maldives. How do you plan to sustain and innovate moving forward? Are you able to mobilize governmental funds, or have you looked to others, investors? Over to you.
Thank you, Christine. DHIS2 experience have been a very useful experience for the Maldives. We've learned, we've evolved. There is so much of learning out there. We do not want to reinvent the wheel. Going forward, I would like to touch base on some keywords. Number one, on sustainability, co-ownership. From our experience, it's important from the beginning to engage all the stakeholders, so that DHIS2 is not seen as Ministry of Health's project or one program's project, but it's seen as like everybody's. It's seen as a long-term effort or long-term strategy towards a vision, shared vision. In our case, we are working. The long-term vision for us is a longitudinal health record across the country. So each of these modules, each of these initiatives is we want them to be sustainable, and we want everybody to contribute to the sustainability. Number two, on the financing, we know that these are like difficult times for governments, for donors, for UN agencies as well, because the contributors are the same for like all of these partners. So we have to look for sustainable financing options. DHIS2, for us, being a main part of the national health policy, being a part of the digital health architecture, being a part of the digital Maldives. Each country has their own digital pathway. So DHIS2 to be a part of the overall main infrastructure, so that it's, again, to get the government funding, it's easier if it's a part of the main policy. It's more longer term. It's not seen as shorter term. There's also collaborating with all the donors, engagement with the donors, with the UN agencies, so that you know exactly which donor, which UN agency contributes to which component of the DHIS2 or your digital health initiative, so that there's collaboration, there's less duplication, and it is more critical, more relevant now, even compared to like last year or 2 years ago, to work, to collaborate on the sustainable financing. And to gain financing, it's easier to work multi-country, multi-projects, multi-programs, because it's easier to convince donors when you work together. Number 3, capacity building. As we go forward, rather than like only relying on external expertise, to build on your own capacity, so that it is more agile, you're able to like attend to issues that you can nationally in like timely manner, so that there's user acceptability, but also having the knowing when to get the expertise. So good collaboration. And lastly, to enhance usability, user support, to give access to users their information, to give information to other sectors, to give information to UN agencies. So it's not only for certain users, like to give access to the public their own information, so that you are also more focused on the quality of the data. They are also demanding for their data, and they are also demanding for the quality of your data. So could go on and on, but for now.
Thank you so much. So let's go to Ghana Health Services. Salamatu Nantogma, Deputy Director, Policy and Planning and Monitor and Evaluation. So what's your, I mean, given the changing funding landscape, what will be the most critical component in order to keep DHIS2 still running, still being part of the innovation community?
Yes, so thank you very much for the question. So I think that she's outlined a lot of the critical things to look at already, but I think I still want to emphasize the issue of sustaining domestic financing. And sustaining domestic finances, meaning that we really have to look at planning comprehensively and budgeting for DHIS2 as we move ahead. We have the National Health Information Strategy that already positions DHIS2 as the national repository. But however, when it comes to budgeting, you don't have it mentioned. And I think that it is important for that to come out clearly, so that we know that this is how we move on from there. Being able to institutionalize DHIS2 and actually adding on the roles that are supposed to ensure that the system functions into our routine HR norms, I think will be a very, very critical thing to look at, because for now, people are employed, just people to work in the space, but the roles should be clearly defined, and it also helps in budgeting and knowing how to be able to plan ahead. And it actually keys into the issues of capacity building, being very intentional about the capacity building and specific and needs-based capacity building to ensure that we are actually retaining knowledge and not just thinking about retaining staff in the long term and all that. One of the things I was thinking about this morning was the fact that in our part of the world, the more people are attracted to a particular thing, it appears very important. So being able to build the DHIS2 community, expand it. And when I say expand it, not just those who are really technical, but even the end users to be able to be part of the community and know we are part of the community. For now, what you realize, end users know DHIS2 is data. But sometimes they have a lot of wild imaginations, but they don't even know what DHIS2 can do for them. And whether they are even part of that DHIS2 family. They feel like an external beneficiary, but not part of the family. So I think that being able to get people to appreciate more of the answers and the solutions it can give to them in their area of practice or in their area of work makes the relevance of DHIS2 better and actually can help us in all the sustainability activities that we want to look at as we move forward. Yeah. Thank you.
Super, thank you. Very inspirational. So let us go back to WHO. How will you save us? WHO is also suffering themselves. But however, what do you think will be the biggest risk for health information systems to stop working?
Thank you. I wouldn't say it is a risk because we shouldn't see it in that way. We need to find a way so that health information system has to be there. I think WHO and the same with lots of the UN, we are facing even worse, in terms of budget cuts, in terms of staff cuts. But then out of that, and now we are restructuring. And I think this is an opportunity as well for two reasons. Number one, in the past few weeks, I have come across and we have been involved in lots of discussions on with the budget cuts, the dimension and the structure of the health information system is changing. There is less money on survey. In the meantime, we are behind a lot on the SDGs and the monitoring of all the national targets. So that we shouldn't say it as a risk. We will say it as a reason why we have to strengthen the health information systems, but also because of all the prioritization is going on. When we have a budget cuts, that means we have to restructure and reprioritize. This is where the roles of data is really, really important. So this would be the first message. Don't see it as a way of losing your position, but this is where you are most needed. That's number one. Number two is with the budget cut as well, and the survey is harder. The use of the routine data is really, really important. And the work on the presentation this week have shown that, there's a lot of innovation going on out there in country where you use the routine data as a way of monitoring, which we understand better, we can respond faster. And then later on, we will shape the way of using and talking to donor on the survey. So survey still we need survey, but we can repurpose it and make it into more a strategic use. And this is where DHIS2 come in. I think, we talk about toolkits. WHO has been working in partnership with Oslo University and the HISP network for the past 5-6 years. And we also need to see how we can continue to make it more effective. And I think from WHO perspective, what we need to do is also to build the capacity of the WHO staff as well. We are now in the positions of discussing the next 4 years of the collaborating centers, which is where we can see how we can shape all of this into the future. The next 4 years, how we can work together with the HISP network, how we can strengthen the use of the data as a drive, not the data collection. And I think this is also a very strong feature of the DHIS with data analytic embedded in that. And now we're on the new development of the AI, of the modeling. I think there's a lots of potential use in there. So, from WHO, what I can say for now is we can use this opportunity of the restructuring and highlight the importance of data and data use, not just within WHO, but also how we can convey that message to all the governments. And we have the ongoing SCORE assessment, which is the assessment of the capacity of all the countries, 158 countries participating in that. And this would be the key way of how we can identify the priorities in the country, calling in the support by all the partners to have a sort of a common targets and common plan for the countries. And 80 plus countries that use DHIS, this is where we can have a new partnership as well.
Super. For those of you not knowing, we have been a collaborative center with the HISP Center, but the whole HISP network actually, with WHO since 2017, and we're going now into a new round, hopefully. So, Dr. Prosper Biombisi, now we are going back to the HISP groups. HISP group leader. So giving this funding landscape, I know that Uganda in particular also, as other countries, has suffered quite a bit from lack of US government funding when it comes to secondment and all. What are the challenges for you to support your country? I mean, also keep the capacity inside the HISP groups. Over to you, Prosper.
Yeah, thank you very much, Professor Christine. Yeah, I think my version is basically the same for all his groups, and so it's not any different from what you have. Yeah, so as his groups, we are part and parcel of the ministries of health, and it's in most countries you'll find that DHIS2 has been pronounced as their national electronic HMIS. And that, what does that mean? That means that that's where they heavily rely on the data, and particularly also for the donors. So for the most of the HISP groups, yes, we've done a great job in trying to build the capacity for the ministries to sustain some of these implementations that has been through capacity building, even working with them. But unfortunately for some countries, we have been working with seconded staff. And so what happens is for when the funding cuts were announced, unfortunately, those partners closed. And so it left a gap with no staff that we even trained. So having very few staff at the Ministry of Health. So of course, this has increased our workload because you have built capacity for quite a long time and they have been working very well and they are now no more. And DHS has continued because the government has continued planning. So it's been a lot of workload for most of us that you have take on more and above what you had planned for. And it has also, it hasn't come to light for most of the partners. We see a lot of dropping because DHIS is not only a platform that is maintained at the national level, being a central repository, there are a lot of structures up to the service provision or the health facilities that support the data collection and transmission. So we will see a lot that is happening in terms of reduced reporting rates, reduced data coming in, which again, as his groups, we have to come in and be able to, see how you make calls, support even to the end level so that data can be coming into the system. But most importantly, this also happened at the point when we are announcing these good new features in the DHIS2. That every country is waiting to see how to get 43 and even now got 44 very soon. So a lot of effect is coming on the infrastructure upgrade to be able to accommodate that. With a lot of presence of partners, we are generating quite a lot of data. And our servers are getting full day by day. So we need to keep, procuring servers and all that. But most importantly, is we are looking at to see that we can keep DHIS2 to the latest versions. But for you to be able to upgrade some of these versions into the new versions, you require training, which the ministries want. And this has heavily been supported by the partners, and so we are going to have a stop and see what kind of mechanisms can we be able to keep and maintain the DHIS tools to the next level. Yeah, I think that's mostly what is affecting us, but we as I think as the HISP group, we really want to appreciate the partners who are supporting and who are still supporting us. We are promising that we'll continue to support. Somebody defined his group as equal to pro bono. So our pro bono work is highly increasing. And of course, we are faced with a situation that we cannot maintain all the staff load that we have. So some may have to become volunteers.
That's a very important point, that in good time, pro bono work works. When you don't have that much money, it doesn't really work.
And the staff.
This is something to think about, just contemplate. So, Dr. Busoya, you can come a bit closer so you can escape from the plant. The plant is nearly killing you. So,
Yeah.
it's the president of Biosystems, dear old friend. Given the changing funding landscape will also affect you as a kind of service provider on top of DHIS2 and using DHIS2 and supporting countries that use DHIS2. So what are you looking at, the changes, the challenges, the risks in the future for the countries you support?
Yeah, it's actually quite good that you use the word changing, because changing has two dimensions to it. In the funding landscape, one is contracting, which is very visible and everybody knows that. But second, it's also dynamic. And this is what people are not really seeing, because there are other sources of funding that are opening up at present that we're seeing. And so in practical terms, from the contracting funding, what we're trying to do with the countries we work with and the clients we work with is to look at cost saving efficiencies. And that's pretty important. For so many years, instances have grown and grown and grown to the point that the cost of maintaining these instances have spiraled exponentially. So we're working with some of our clients to actually see how they can consolidate those instances to bring the cost down, not just the cost in terms of the infrastructure of hosting, but on the human resource for maintaining these instances by reducing the complexity. If you have 10 years worth of data in an instance, do you need 10 years worth of data operationally at your fingertips, as an example? So that's one thing we're doing. On the dynamic side, what we've been able to do is look at other funding avenues, people who are trying, organizations and foundations that are stepping up to fill the gap. Some of these are short-term, and it's been absolutely remarkable. The level of solidarity, that things don't fall apart, is very high, and it's been very comforting for us. And I think that we will be seeing more of that in the future. So one, reduce your cost, and two, proactively engage other sources of funding that can help stop the gap, even if it's temporarily, because we know that political dynamics are also not forever. Things change on a daily basis.
Thank you, Busoya. And while this changing is going on, what do you see as a kind of an opportunity? I mean, we have now talked a lot about the changes, celebrating that we will now collaborate and unite and partner. Do you have any thoughts about how can we partner now in a bit different way in the future?
Yeah.
I mean, the year to come. Let's take 1 year, or maybe 3 years, or 3.5 years to come.
I would say 3 years, maybe. Alliances are critical now. Where we used to have competitors, perhaps that still maintains in some form, but collaboration, the greater good trumps the individual benefit. And we need to begin to reimagine and reframe what the market is. And as we reframe what the market is and what the new normal is in terms of funding and what we can achieve and where we can achieve it, we can come together and leverage the strengths of different organizations to provide more for less and to be able to open doors that individual organizations can't open. And this is at multiple levels. So there are certain global organizations that are interested in coverage and footprint. as an organization, we can't be in every country. So what do? We are able to tap into the richness of coverage that the HIS groups over many years have been able to develop. So if organizations are saying, BAO, how many countries can you service for us and set up these instances in the next 6 weeks? We're not going to be in Asia and in Bali in 6 weeks. That is not going to. So we know our man in the house who's HIS Asia. In Africa, we have HIS Africa. So in terms of coverage, alliances with local organizations that have developed trust and credibility and legitimacy is critical. And sometimes we might not have the same economic and business strategy, but we can still work together and above all those things. From a more strategic position, there are certain foundations that we also find that if we knock on the door, they don't know who we are, or they don't have enough information about us. And so, again, to be able to work with trusted, known globally sort of brands like the University of Oslo, maybe even Global Fund and WHO, to come alongside to present a compelling proposition to these large foundations that sometimes the problem is not the funding, is where to direct the funding and to give them a vision for what their funds can do. I think it's an unimaginable, limitless possibilities in those kind of collaborations going forward.
Very, very true, as we normally say, which is not really good words these days, but however, we have absorptive capacity because we are so many. And we have shown that we can turn around fast. So I'm now twisting my head whether I should go to Maldives or I should go to continue with his group. I think I will turn my eyes on Maldives because it's interesting also to hear from the ministry side how you look at it. I mean, Aishat Samaya, how do you think the potential for collaboration now? What can we do now that we maybe didn't think about earlier? Yeah, you have.
There are many avenues. I would like to touch on some. One is like collaborative work together. Like even in the sessions, we found that like we were working on the cancer registry. Some of the African countries are also working on the cancer registry. So these are like funding that spend like around the same time. Could be like very similar. We haven't seen the modules, but then if we could work together on shared like modules, this could like we could combine the funding and we could have a shared module or shared like vision. So this could really work and work in smarter, working together smarter. So there are like many collaborative approach, like learning from each other. So there are like many similar countries. If we could learn from each other, if we could have like exchange programs, then we would move faster. There are so much of opportunities and opportunities of funding where we haven't gone into like climate change and health. Like there is a lot of funding available, but we might not link our modules or our system with climate change and funding. But then wherever there are funding to link and develop our system through them. So the option is really unlimited.
Thank you. And moving over to Ghana, I just want to appreciate and maybe brag a bit about the Ghana Health Service. It's always been very, very fast and furious when uptaking innovations, building capacity inside the ministry, which is actually pretty cool. And that's kind of like a lighthouse, I would say, to see how far we can go with the own capacity. However, I mean, so what do you think that this kind of changing dynamics, as Bisoye talking about, that's always an opportunity. What do you think we could do together now that we could initiate when we have so many partners in the room, we have so many different agencies, and there's so many unsolved problems?
Yes, so yeah, that's I think being able to, like you mentioned earlier, being able to pool the resources together from different avenues to be able to focus it and manage it in a more efficient way will be a very good place to look at in terms of ensuring that we're able to get sustainable funding for the DHIS2 system and as we move along. And also in terms of cross-sectorial inter-collaborations. So you may have, for instance, in Ghana, whether statistical service, the meteorological service, or you may have the bets and dates and all that. We seem to be building different systems to do the same thing. So collaborating and Ernestine putting all the efforts together and the funding together will be a good place to look at ensuring that we are efficient, we are solving the problem together, and actually linking the data and answering the questions that we want to answer will be a good place to look at. And also regional collaborations within even the African region, being able to gain from technical support from each other in terms of capacity building as well will also help in sustaining DHIS2 also as we move along. There's a lot of homegrown technical expertise as well that we have to look for instead of always looking out for it as well. And that will also help in the long run to ensure that we are using the little funding that we have to go as far as we can.
Thank you so much. WHO, Anne. So what do you think WHO can contribute when it's come to this kind of maybe cost-effective collaboration? I'm a bit inspired. I'm thinking of, even though we mobilized a lot of funds during the pandemic, however, we were locked down and we were creative and we started to collaborate across the globe. We didn't even care which continent, whether it was innovation from Sri Lanka going to Ghana or to Uganda or to Tanzania, we didn't care. So, I mean, difficult times also call for creativity. How can WHO help?
Well, I think I like the word alliance. That's what we need to be together. There are two things. I have been trying, calling for the supporting for the core function of health information systems. And DHIS is a very good example of that when you have the foundational functions. Most of the donors and partners, when they fund programs and they fund the data. But actually everybody overlooked what builds those data and reporting systems. And I'm using this opportunity to call for all the partners. Between DHIS and also with WHO, especially on when you roll out in country, we're always trying to build on that. But I think we need that recognition by other partners as well, that we need to put a certain percentage of whatever programs that need to go into the core function and the capacity. And it's more important than ever because we can't afford to have a separate system, a separate server, and constantly pinching start from one to the others. And I think you will see that in the country a lot. So that is the first call. Second is we can join together and have a certain, I like the way you said as well, approach different donors and partners to see if we can have it as a collaborative work and support certain country. And when we have identified common priorities and common goals, this is where we can do it together. Everybody look at WHO as a donor, and we are not donor. But what we can do is we can try to bring all different technical programs together. And we have done that together, and we've tried to implement. But I think the next round is to see how we can sort of optimize it, emphasize it, and see the showing more impact of the work, because we also need to work a lot for the country, because at the end of the day, the ministry has a lot of decisions, whether you wanted to have it as a part of the platform or you want it separate. And I know it needs a lot of guts and courage to say, no, we do not want that sort of funding for a separate program, but we want to work it together. And I think this is a place that we can call for that. And that will be something from WHO we're trying to continue with a couple of global reports and strategies coming out soon.
Thank you, Anne, for reminding us about the partnership that we have had since 2012 when it comes to investors that have worked together. And it was actually WHO, Global Fund, Gavi, PEPFAR, CDC,
Gates.
etc., UNICEF, etc. Welcomes later. That's now. But NORAD, of course, all actually accommodated by the core Norwegian aid agency, NORAD. Thank you, NORAD. But NORAD is not in the room. But however, so reminding us, I think we need to think differently, because we were able to have this partnership with technical people with the heart on the right place to understand that the core, this is an investment in the future. This is an investment for all the countries, not only for one country, not only for one program. It's not for one pilotitis or some evidence-based something innovations, but a generic platform for everybody to be used. And in order to be able to use it, you need to be documented, you need to be guidelines, we need to work with WHO on best practices, etc. Maybe we should think about partnership in a different way. Because the donors, they're not there, except on NORAD. The best friends. We have gone back to basic. So since 94, NORAD has been supporting us, and they're still supporting us. And without NORAD, we wouldn't nearly be here. So I think maybe we could think about partnerships in a different way, because we have, it's interesting to see that hardly any investors are in this room. It used to be a lot, and now it's not, for reasons. So how can we turn this and think partnership in a different way? To think about how can we partner? I know that is not a question for you particularly, Prosper, but what I really think that we forget, and I think Busoy started it, was actually thinking about how cost effective it is to work with local partners like the HISP groups that already have the eyes and the ears to the government and the door pretty open. However, if it's not you can come there and leave, because then the HISP group have to continue to live with that innovation for the rest of their life. Yeah. So we are there to stay, or us. However, thinking about this partnership, thinking locally more partnership, maybe more university. I know universities don't have money, but I mean, in the end, what we are well known for is to do a lot with a little. So maybe ask for many littles. Prosper, any ideas? Sorry.
Yeah.
And audience, you are allowed for a few comments, if I'm not, maybe not so many, but maybe one, if anyone.
Yeah, so thank you very much. Actually, Busoy has really put it very, very well. But collaboration and sharing is one of our core values in HISP. We just eat collaboration for breakfast, lunch, and dinner. So if you want to come to the HISP network, you must be a collaborative and you must be willing to share. And so this has really to us brought a lot to us, and that's why we can say that DHIS2 has been successful for all these 50 years, and no wonder we are in this so many countries. So in collaborations, of course, as from this conference, we look at so many ways of really, of course, first of all, intensifying our collaboration and sharing. To stop the reinventing of the wheel so that we can be able to save on the fuel costs. If an app is working very well here, let's be able to share, to have it used across. And we've seen this work very well for education. Share and collaborate across the HISP groups in terms of the human resource. So if you wanted, you are working in West Africa, there is a good resource in East Africa. HISP Africa will get that resource for you there, and you'll be able to be able to operate. We are also looking at collaboration also in a way to adding more tools in our toolbox. We had a good meeting yesterday talking about the different, GPD open source softwares and the proprietary softwares. So that we are, as HISP groups, we are really ready to collaborate and be able to add this into the toolbox of the Ministry of Health and Education and other ministries as a tool that can be supported. But we need to really work together, because as HISP groups, we work for sustainability. We don't work and just get out the next day. We are there for life. So we are willing and looking to see those collaborations. We are also intensifying our collaborations with the cross sectors. And now we're talking about climate. We started with climate for health, but everybody's in the different ministries asking for climate data, education, and agriculture and all that. So those collaborations are also going to be able to bring us more resources that we can be able to use to maintain this public good. Then lastly is also on resource mobilization. We are reaching out to all the different partners to allow us to collaborate to be able to resources that can sustain these implementations. And of course, you've talked about universities as HIS groups, it's research. So a lot of collaborations are happening in the different HIS groups with universities, and there are research initiatives coming up. There's mental health, which is through Wellcome Trust in most of the countries. And so we look forward to more strengthening these collaborations. But as you come to our collaborations, you come to our network, be willing to share and be willing to work for sustainability. Thank you.
Thank you, Prosper. Maybe a bit of a hand there. We have also set up the 25 HISP groups, new one just now, and plus the HISP Center. But the 25 HISP groups is now organized in 2 hubs, being ready for partnerships, being ready to actually take on partnerships across HISP groups. So the HISP Africa and the HISP Asia is actually a mechanism to be able to partner across the HISP groups in the region, and not only with one by one by one by one. Anyone in the audience that would like to give a comment or a question to this esteemed, fantastic panel? You all are hungry for lunch. We are late lunch. I really think, I can't see anyone. I really think we should give a big hand for this panel. I think you guys gave a very, very food for thoughts, food for conversation during our Sognsvann social event. Ola will talk about how you get there and all these more practical things. However, please continue the debate, please continue the discussion, and we will think about, and we will do, and we try to make new partnerships and new way of working together. And thank you so much for coming for this conference, and thank you so much for the panel. New hat. Thank you.